So your child's delayed. What should you do? Well, if you had a child in the last 3 to 4 years, we are seeing a ton of delays in communication and socialization as a result of the pandemic. Their childhood looked very different than any other kids in previous generations, and so their development is looking very atypical. However, it can be very difficult to determine whether or not your child simply has delays as a result of growing up during the COVID-19 pandemic, or if they actually should have a diagnosis of autism spectrum disorder. And so how can you tell the difference? First, I want to say this video should not be a replacement for formal diagnostic assessment and evaluation. This is simply identifying the differences that I am seeing as a professional in children who are having some delays in socialization and communication versus children who have a diagnosis of autism. They can look similar in a couple of different areas, so that's what I'm going to highlight in this video. A diagnosis of autism has 3 separate criteria that need to be met in order to get that diagnosis. And the first criteria is a deficit in communication, which we are also seeing in COVID babies. And this could be, just talking late. This could be that when language developed, it sort of stunted at the 1-word level. It could be we haven't started talking at all yet. It could have been babbling may have happened later than normal. So there's a very wide range in what the communication deficits could look like, but it is something that we are seeing sort of consistently across kids who were born in and around the pandemic and kids that have autism. The second area of an autism diagnosis is a deficit in socialization or social skills. Again, also something that we are seeing with our COVID babies. And this could look like a kid who would rather play alone than play with others, or a kid who may play next to other kids but may not join in their play themes. It could be that they're not having conversations or chatting with other kids. Or it could be a kid who simply kind of looks like they're on their own little planet and has no interest in involving themselves with the rest of the social community. And then the third area of an autism diagnosis is restrictive or repetitive behaviors. And this is the one area that we are seeing that is unique to autism, and that is not necessarily something we're seeing emerge as a result of delays because of COVID-19. So restrictive and repetitive behavior could look like hand flapping, body rocking, spinning in circles, maybe waving fingers and sort of looking out of the side of our eyes at them. It could be vocalizations. It could be singing songs to themselves or making repetitive sounds. And what these repetitive and restrictive behaviors are basically self-stimulatory. It means that the behavior itself is sort of producing its own stimulation for your child that's enjoyable. And so your child is going to continue to engage in it. And the reason that it's problematic is that it can interfere with your child's ability to learn in the natural environment. If I'm spending most of my time sort of looking over here at my fingers waggling, I'm not looking at other people. I'm not making social connections. I'm not looking at the teacher in the front of the classroom. So that's why that can be problematic. But again, that one specific area is the area that, in my opinion, really differentiates a diagnosis of autism versus maybe some social and communication delays that we're seeing with some of our kids that grew up during the COVID-19 pandemic. But again, if you're experiencing any delays at all with your child, if they're not hitting their developmental milestones, please be on top of talking with your child's pediatrician. Most pediatricians are waiting until kids are 18 months old in order to officially refer them for speech and language pathology. In my opinion, there's so many language markers that lead up to that 18-month mark that are indicative of a slowdown in language development. So even at like the 6 to 8 month, if your child's not babbling, that's something that you want to definitely be on top of and looking at ways that you can be working on stimulating your child's communication. So yes, it's important to speak with your pediatrician, but you need to be your child's best advocate. And the more that you know about where your child should be, the better equipped you are going to be in order to get them what they need and start the process of working on whatever their delays are, whether that's we're simply looking at social delays or communication delays, or whether we're looking at getting a diagnosis of autism and starting the route down some roads of therapy for your child. So please make sure to learn where your child should be and speak up and be their advocate on getting what they need.